begin tonight at 5 with new information about a deadly fungal infection that the CDC says is spreading at an alarming rate.
Yeah, but local health officials say it's not really the case here in San Diego specifically, though they are remaining on high alert. Our Sarah Legre starts us off live tonight outside Rady Children's Hospital with what you need to know about it. Hi, Sarah.
Hi, Andrew Maria. Yeah, Rady Children's Hospital today addressing the alarming spread of the deadly infection, otherwise known as Candida auris. Now, they say, well, it's not currently an issue right here at home. It's only a matter of time before it makes its way to San Diego.
People in San Diego who are reasonably healthy, you don't have to worry about this.
A warning coupled with reassurance to the community amid high tension nationwide following the ever-growing spread of a deadly fungus, Candida auris, also known as C. auris.
It's a word of caution to all the hospitals in the United States that this particular Candida strain is spreading.
The big question, what is it and who does it target? According to Dr. John Bradley, medical director of infectious diseases with Rady's, it's a form of a yeast infection or a so-called superbug, characterized by its resistance to medications. Those infected commonly show these symptoms.
Either a red sore patch in your mouth or in your intestines, which you can't see, or if it invades fever, and that's the most common. If the Candida should settle in one of your organs like the lung, then you'll start to cough and you could get a smoldering, increasingly serious pneumonia.
The fungus is mainly a concern with those who are immunocompromised patients, stemming from children to seniors. The concern at Rady's lies within their cancer patients.
If you're an immune-compromised host, once it enters, it can really cause an infection. So for healthy people, the regular Candida albicans that causes thrush is not a real concern, and Candida auris for regular people who aren't immune compromised is not an issue.
The CDC is calling the fungus a, quote, urgent threat while noting its resistance to medications. But according to Dr. Bradley, it's both preventable and treatable.
But I want to reassure everyone that this isn't a situation where we have nothing. We have more powerful agents, but they're ones that we usually hold in reserve and don't start out with treatment.
Now, currently in the state of California, there have been a reported 350 cases as of December of last year. There have been no reported cases yet here in San Diego. Now, if this were to occur, it would mainly start within our local hospitals. That's why the team at Rady is saying they're trying their best to get ahead of this issue, mainly through early detection and testing. For now, that's the very latest outside of Rady Children's Hospital. Sarah Legre, Fox 5 News.
Important to take those early steps. All right, Sarah, thank you.